Hello, everyone. I'm Congressmember Karen Bass, Chair of the Congressional Black Caucus and Chair of the House Foreign Affairs Subcommittee on Africa. I would like to welcome you to the first ever virtual Africa Braintrust as part of the Congressional Black Caucus's Foundation Annual Legislative Conference. The world has changed dramatically since last year's Braintrust. We certainly would not have predicted that at this time we would be in the middle of a global pandemic. On the domestic front, the United States has had to confront many of the issues that our own State Department has often raised with African governments in the past, such as democratic backsliding, a head of state with autocratic tendencies, a protest movement emerging out of long-term and systemic grievances, a violent crackdown on peaceful protesters, and questions about election transparency. Those are our issues as well. Some have asked, where do we go from here or what this will mean for long-term US leadership in the world? I'm optimistic. I think we can use our domestic experiences to show countries that we will abide by the law. We will hold elections when they are scheduled, and if we are to unseat a president, it will be through democratic elections. What better way to display leadership than by modeling it? Many of you working on Africa and international affairs have expressed your concerns about the international response to COVID-19, which is the topic of today's Africa Braintrust, the coronavirus pandemic, the spread, the response, and the impact across Africa. Today, we will examine what is happening on the continent, the potential long-term impacts of the pandemic across Africa, how the international community can support response efforts, and lessons we can take from previous successful efforts to fight disease on the continent like Ebola. We will also look at how African leaders can be deterred from using this serious pandemic for personal gains. As of August, the official number of COVID-19 cases across Africa surpassed 1 million. Many people argue that this is just a fraction of the true number of cases in Africa's 55 countries. They point to the overstressed healthcare system and limited screening capacity. The low rate of transmission, however, might also be attributed to countries that took early action to reduce the spread. They had clear, consistent messaging about the virus and mounted public education campaigns informed by prior experience with Ebola and malaria. They limited entry and quarantined people from places with known outbreaks. They limited large gatherings, and countries such as Rwanda and Ghana made technical innovations by using drones to deliver medical supplies to rural areas. We are privileged today to learn about this situation directly from the head of the Africa CDC, Dr. John Kingagswang. He was appointed director of the Africa Centers for Disease Control and Prevention in November 2016 and is a leading virologist with nearly 30 years of work experience in public health. With more than 120 publications in internationally recognized journals, the doctor has received multiple awards, including the Award for Excellence in Public Health Protection Research from the U.S. Secretary of Health and Human Services.
Greetings from Addis Ababa, from the headquarters of the African Union Commission, specifically from the Africa Centers for Disease Control and Prevention. I'm delighted to have been asked to make a few comments concerning the COVID-19 situation on the continent. As we speak, as a continent of 55 member states, we've recorded 1.2 million infections related to COVID-19. And of these, unfortunately, about 30,000 Africans have died from it. COVID-19 represents a generational crisis for the continent in several dimensions. First of all, it has impacted tremendously the efforts and gains that we've made in controlling other endemic diseases on the continent in a very significant manner. That is, challenges related to HIV/AIDS, tuberculosis, and malaria. It is estimated that if COVID continues to infect people in Africa, about 500,000 Africans may die because of HIV in excess than otherwise would have been the case. COVID-19 represents a major challenge to the economic developments and gains. In particular, as you all are aware, the continent is in the process of moving forward with its Continental Free Trade Agreement, which will be the largest free trade area in the world, including about 1.2 billion people. However, this important aspect, important developmental component for the continental aspiration will not be met if COVID is not brought under control in Africa in a significant way. We all recognize that COVID infection in Africa means COVID infection everywhere in the world, because we all have learned in the past 8 months that it takes only a few cases of COVID-19 to spark an outbreak and expand tremendously. This is a virus that spreads quickly, infects so many people, and is lethal to our population of humankind. So an infection or a threat anywhere in the world will continue to be a threat everywhere in the world. A continent of 1.2 billion people have to work collectively, cooperatively, and coordinate their efforts in order to combat the battle against COVID-19. And to do this, it will require partnership and cooperation with the rest of the world in several areas. First of all, we need to continue to expand our testing capacity and capabilities so that we can find where the hotspots are, work hard with public health experts to control them effectively. Second is that we have to strengthen our health systems in a manner that will outlive these efforts against COVID-19 on the continent so that we can continue to use them to battle other disease outbreaks like the Ebola. As we speak, we actually have an ongoing Ebola outbreak in the Democratic Republic of Congo that has infected close to 100 people and killed about 60 of them. This outbreak, that is the Ebola in western part of the Democratic Republic of Congo, is not discussed in the media enough because COVID has completely taken over that. We have tuberculosis, malaria challenges that we have to deal with, which all require strengthening our health systems. We need to come out of this pandemic stronger than we went into the pandemic. And the way to come out of this pandemic is clearly through a vaccines. And Africa has to be considered and factored into the discussion about access to effective vaccines once they become available. Only through global solidarity and global action are we going to collectively defeat COVID-19 in Africa through the expansion and implementation of an eventual effective COVID vaccine. COVID vaccines should be seen as a tool for common good and public good for the humankind. We are challenged as human beings in the last 100 years in an unprecedented manner. And it requires collective solidarity, collective actions to find a solution to this global crisis. And how quickly we ensure our cooperation and solidarity will enable us to come out of this crisis very, very quickly. It is our pleasure, as the Africa Centers for Disease Control and Prevention, to continue to support member states in the best we can, using the limited resources that we have in order to enable them fight this pandemic in a decisive manner. And we count on the partnership, cooperation, and collaboration with our traditional partners, including the efforts made by the United States government, especially similar to the efforts of the PEPFAR program, which has become a life-saving initiative on the continent of Africa. Thank you very much for the opportunity to talk to you this afternoon.
Thank you, Doctor. I also want to point out that musicians and activists across the continent have used their popularity to amplify COVID-19 awareness. In Uganda, singer Bobby Wine, the government's main opposition leader, has created a song, The Coronavirus Alert. In Senegal, an activist hip hop group released a song titled Shield Against Coronavirus about hand washing, disposal of used tissues, and avoiding crowded areas. A popular Nigerian singer posted a photo wearing a face mask and holding a bottle of hand sanitizer. And in Liberia, the president released a 6-minute song called Let's Stand Together and Fight Coronavirus, explaining how the virus is spread and urging hand washing. As you can imagine, the pandemic-driven national lockdowns, border closures, and restrictions have disrupted African economies, including in production and supply chains, trade within Africa, and trade outside of the continent. These factors, in combination with some countries' pre-existing challenges, have caused serious economic contraction across Africa. The World Bank forecasts that the pandemic could force tens of millions of Africans into extreme poverty. The World Food Program anticipates that COVID-19 will aggravate existing challenges and may leave 143 million Africans facing acute food insecurity in 2020. Some governments have restricted free speech and press and freedoms, claiming that it's for public health and safety. Others have used COVID-19 to arrest and detain opponents and curtail civil liberties and human rights. So on to our panel. To set the stage for the other speakers, Dr. Mande Mugengwa will give us an overview of how this virus is affecting the many different regions of this vast continent. And next, Dr. Raymond Gilpin will dive deeper into economic concerns on the continent. Finally, Travis Adkins will review the political situation, including in several countries where the virus is offering an excuse for repression. I look forward to the conversation after their presentations. Now let me introduce our first speaker. Dr. Mande Mugengwa is director of the Africa program at the Woodrow Wilson Center in Washington, D.C. She heads their work to analyze and offer practical, action-able policy options addressing some of Africa's most critical issues. She holds a PhD from Oxford University, and she was a Rhodes Scholar. She has worked in prestigious academic settings, and she serves on the Board of Trustees at the Freedom House. We will then hear from Dr. Raymond Gilpin, who is the Chief Economist and Head of Strategy, Analysis, and Research at the United Nations Development Program for Africa. Prior to joining UNDP, Dr. Gilpin worked at the Africa Center for Strategic Studies in Washington, D.C., and at the U.S. Institute of Peace. In 2015, he was inducted into the Martin Luther King College of Scholars at the historic Morehouse College in Atlanta for his work on economics and peace. He holds a PhD from Cambridge University. And finally, we will hear from Mr. Travis Adkins, who is a lecturer in African and Security Studies at the Walsh School of Foreign Service at Georgetown University. He has worked in governance, civil society, and refugee and migration affairs in over 50 nations, including his service in numerous international election observation missions throughout Africa and the Middle East with the National Democratic Institute. Mr. Atkins is also a frequent contributor to numerous newspapers and is the creator and host of the On Africa podcast. Dr. Mande, will you take it away?
Good morning, everyone, and thank you, Congressmember Bass, for that very kind introduction. But more importantly, thank you to you and the Congressional Black Caucus Foundation for convening this very important discussion. The discussion could not be more timely, given the social, economic, and political impacts of COVID-19 that continue to reverberate across the continent. In setting the overview for my two co-panelists, I want to focus on two major positives that I see that have come out of Africa's response to the crisis, and then speak to four core challenges that I see that the continent needs to grapple with in order to more effectively combat COVID-19 on the continent. The first positive that I want to focus on is leadership. And here I want to make a distinction between leadership at the continental level and leadership at the national level. My focus is just on leadership at the continental level. I believe that the African Union, the Africa CDC, has shown tremendous leadership in fighting this crisis. As we look over the last 8 months, we see an African Union, an African CDC, and a World Health Organization Africa region effort that has led continental efforts in the development of a continental framework for combating COVID-19, in providing guidance to AU member countries on the various COVID-related issues, in developing infrastructure for coordination at the continental, sub-regional, and regional levels, generating and sharing knowledge and training for member countries, making more labs on the continent COVID ready, and creating a continental portal to facilitate procurement of vetted PPE, which has been a challenge across the world, not just in Africa. So while the negative impact on the continent should not be minimized or underestimated, I believe that it is true to say that this crisis would have been much, much bigger, but for the leadership efforts at that continental level. What we see when we look at the continental level response is a much more robust and comprehensive response compared to the continent's response to Ebola in 2014 to 2016. Clearly, the continent learned lessons from the Ebola crisis, and the 3-year-old CDC Africa has made a big difference in the fight to COVID-19. The second major positive that I would like to highlight is what Congressmember Bass already talked about, African innovation that has been born out of this crisis. We see young Africans especially responding to create solutions to combating COVID-19 on the continent. These have been as simple as gadgets such as a wooden hand washing machine, a basic portable ventilator, a multifunctional medical apparatus, production of face masks using 3D printing, and clinical trials that are being undertaken on the continent to create COVID-19 vaccines. This African innovation is critically important, and properly harnessed, tested, and mass-produced, it could help address some of the challenges that Africa is currently facing in combating the crisis, while enhancing preparedness for the next crisis and also creating much-needed jobs on the continent. The steps taken by the World Health Organization in launching an African Innovation Challenge to solve African health challenges is one in the right direction, and it should be maintained and replicated at the national level. So those are two big picture positives that I think we should applaud on the African continent. Strong continental leadership and innovation that is coming out of the continent. Let me now turn to 4 major challenges that I see in Africa's response to the pandemic. The first challenge has already been talked about by the CDC Africa Director, as well as Congressmember Bass, in that it is still very difficult to gauge the true state and trajectory of COVID-19 on the continent, mainly because of the variation in national level responses, but also as a result of very low levels of testing. And there are several issues here. Overall, testing remains very low across the continent, with a little over 11 million tests conducted by the end of August, and with 11 countries accounting for 80% of all those tests. The second issue is that countries use different strategies to test, including random testing, testing only those who present for symptoms, or testing only the most at-risk populations. The third issue is that we have delays in reporting on the results. And then finally, and this cannot be discounted, is that some African leaders have made unhelpful comments, which suggest that they're not prioritizing COVID the way that they should be, in terms of questioning both whether COVID-19 is real and as well as questioning the efficacy of COVID tests. No doubt, these attitudes have informed national level responses, and that is a factor that ought to be addressed. The second challenge has been the heavy-handed response of enforcement of COVID-related measures such as lockdown. Most African countries opted to use their security forces, especially police and paramilitary forces, to enforce COVID measures such as lockdowns and mask wearing. What we have seen is a heavy-handed response in enforcing those measures, which has resulted in human rights abuses, resulted in a setback of healthy civil-military relations, and a further erosion of citizen trust in their government. The third challenge relates to sexual and gender-based violence. Many countries around the world, Africa included, have documented increases in violence against women and children during lockdowns. Unfortunately, responses around the world, again, including in Africa, have been gender blind. And so far, we have not seen a comprehensive response to how you address these first and second order impacts and fallouts of our responses to COVID-19. The African Union and national governments need to do more to account for gender in their strategy and responses. The fourth and final challenge from my perspective has to do with the need for the continent to expeditiously develop sectoral strategies related to COVID. I want to highlight this using the education sector. Africa's biggest and most valuable resource is her people, particularly its young generation. Yet COVID-19 has exposed the challenges and the inequities with regard to educating and empowering Africa's youth. Currently, 297 million learners in Africa are out of school because of the pandemic. And therefore, the continent faces the prospect of a lost generation. The point is that beyond developing national COVID strategies, which many African countries are doing, they also need to develop individual COVID strategies for their various sectors. A number of African countries, over 20, have closed their schools until 2021. If the expectation is that we will get back to the pre-COVID normal, that is likely not going to happen. And therefore, strategies that account for both the current COVID pandemic as well as the new normal that expects future pandemics to enhance various sectors and strategies should be in development right now, because the next pandemic is on the way. And so with that, those were just a few ideas on various points of entry and focus that African governments should be looking at in terms of weathering the current pandemic, as well as preparing for the post-COVID environment. Thank you.
Thank you so much. Dr. Gilpin.
Thank you so much, Congresswoman Bass, and thanks to the Congressional Black Caucus for organizing this first virtual Africa Braintrust. COVID-19 in Africa, as previous speakers have already mentioned, is both a challenge and an opportunity. But from an economic perspective, it's very important to note that so far, estimates suggest that COVID-19 will cost Africa $500 billion in lost export earnings this year alone, $200 billion in income losses. Between February and April this year, $4.2 billion of foreign direct investment left the continent in capital flights. These are big numbers, these are significant numbers, because they come at a time when most African countries were actually beginning to grapple with some of the development and investment challenges that have plagued their societies for decades. But let us think through how COVID impacts these economic indicators. And there are three pathways. The first is external trade. Even before the health crisis hit the continent, most African countries were reeling from shocks to both their exports and the imports. And this combination of a demand and supply shock really affected not just the availability of basic commodities in African countries, but closed markets to most of their exports. And we know that a fair amount of African countries are reliant on one or two exports. The second pathway is the disruption in domestic value and supply chains. And this meant that a lot of businesses that offer goods and services that are responsible for productivity, exports and imports ground to a halt. And people were no longer able to offer their services and facilitate domestic trade. The third pathway is the health response, which Dr. Mugengwa just mentioned. African countries correctly responded early and responded with quarantines, shutdowns, etc. And this really hit the economy hard because a predominant amount of Africa's labor force are daily waged. And so not being able to go out to work really had a debilitating effect on not just household budgets, but national budgets as well. The combined effects of these external, domestic, and health pathway shocks has meant that this year, Africa's growth, GDP growth, is going to contract sharply, reversing over 3 decades of continuous growth. What are some of the consequences of this? Job losses. 75% of non-formal jobs are at risk. Over 24 million jobs in the tourism sector alone at risk. Food insecurity. According to the FAO, 168 million Africans cannot afford their pre-COVID levels of food intake. A new debt crisis. COVID has pushed Africa's debt to 65% of GDP. We're seeing poverty. The CDC director mentioned this. Over 30 million Africans are being pushed back into extreme poverty. As I said earlier, this is a challenge, but also an opportunity. And to paraphrase British Prime Minister Winston Churchill, African countries and African stakeholders are intent on not wasting a good crisis. So let's take a look at what some African countries are doing. First of all, they are focusing on how to restructure trade and do it within the context of the Africa Continental Free Trade Area arrangements. If this mechanism has the capacity to increase Africa's trade from 2.3 trillion currently to 6.2 trillion by 2030. African countries are also looking at social protection. We know that in most countries, particularly the vulnerable and non-formal workers, have no social protection. So far, African countries have committed 3% of GDP from their own domestic resources to provide social protection, mainly through cash transfers. Cameroon is providing fiscal stimulus for green and sustainable projects. Rwanda is using innovative artificial intelligence mechanisms and infotech to address some of the healthcare challenges that are arising. Senegal is partnering with Mologic in the UK to manufacture PPEs. Botswana has launched a national social protection recovery plan. All of this shows that African countries are not sitting and waiting. They recognize the import of structural economic transformation in this context, and they're already taking steps towards pushing this forward. Africa's partners are also doing a lot. The African Development Bank Group announced a $10 billion COVID response facility. UNDP where I work, published Beyond Recovery Towards 2030, based on 4 pillars: social protection, governance, digital disruption, and the green economy. UNDP's accelerator labs are in 40 African countries, and they provide incubators for innovation. We see that in these accelerator labs on the African continent, 50% of the innovators are women. UNDP's Youth Connect, also present in over 10 African countries, is connecting Africa's young entrepreneurs to their peers, to mentors, to skills, to financing and marketing opportunities. COVID-19 could be that strategic juncture that allows African countries, African organizations, and Africa's development partners to reset the development trajectory. In closing, what would this look like moving forward? There are 5 things I'd like to highlight. The first is triggering structural economic transformation in Africa. The second is advancing regional trade. Third, prioritizing digitization and environmental sustainability. Fourth, shifting from development funding through aid to development financing by utilizing Africa's natural resources for national and regional advancements. And fifth, innovative partnerships with both traditional and non-traditional partners. COVID-19, as I said earlier, has been a significant and unprecedented economic shock, and the response has to be equal to that challenge. Thank you very much.
And thank you. Let me now go to Mr. Travis Adkins.
Thank you so much for the kind introduction, Congressmember Bass, and thank you to my excellent co-panelists for their brilliant outlining of some of the issues at hand as we deal with the coronavirus pandemic nationally and globally. In terms of what we see happening on the continent, there are 2 things really at the personal level that we have all been advised of in our nation and across the world, which I would like to take and expand for us to look at the continent and look at what's happening nationally across the continent. And those 2 concepts are the concept of underlying conditions and exposure. And so what we know is that underlying conditions make all of us more vulnerable to increased death, to more severe illnesses, and to more long-term impacts from the coronavirus infection. And if we take that up to a regional and a national level, we would know that things like fragile governance, poverty, poor healthcare infrastructure, ongoing conflict, and things of that nature would impede those governments' ability and sometimes even their willingness to effectively address the pandemic as it kind of unrolls itself. In terms of exposure, though most of us, I should say all of us, have been advised to avoid exposure at all costs, those who cannot avoid exposure at a time like this are governments, are political leaders, are our global institutions that are charged with meeting the challenge of containing this virus, as well as to attending to those who are most deeply impacted. In terms of governance and human rights and access, the first thing I would point out is just the human right to actually having information. And one of the first challenges we see with that is the lack of data on the continent. And some reports are calling the continent a global blind spot, just because there's such a mixed bag of data and information from varying countries. And now in some instances, it is an underlying condition of governments who actually are not able, in terms of financing, in terms of infrastructure and services, to be able to collect such data. But in other instances, it is the fear of exposure. Governments who don't have the political will to share the data, governments who have the data and suppress it because they don't either want to stoke fear or shine a light of incompetence or poor leadership on their parts. And we see this kind of most pointedly in places like Equatorial Guinea, that has ousted its World Health Organization representative. In places like Kenya, in nations like Burundi, where many in the diplomatic and kind of global health specter essentially kind of speculate that President Nkurunziza perhaps may have even passed from the coronavirus. And so you see in many instances the role of government in keeping this at bay. Now, in terms of positives, I would point out that Senegal and Ghana have both joined forces and are looking at developing a $1 testing kit that gives results within 10 minutes. Additionally, when you look at Namibia, they have just come out and announced today a data hub for COVID-19 data to keep their citizens and their neighbors abreast of what the pandemic is doing in their part of the world. In terms of governance as it relates to conflict, again, these same underlying conditions are what put citizens and nations at risk. And one of the things we saw, even when we went through the Ebola pandemic, is sometimes you see a global shift to focus on one disease or one outbreak as if HIV/AIDS is not still an issue, as if chronic disease related to waterborne illnesses are not going to still kill people, malaria, and so forth. And so this essentially works as a compounding mechanism for those. Also, as Mande mentioned, this kind of pre-existing mistrust between citizens and government is compounded in this moment as well. The lack of transparency, the lack of data, the suppression of media in many instances creates an environment for the spread of misinformation and disinformation and misunderstandings. And so one of the core threats there is the implementation of emergency laws across the continent, which are, of course, standard in terms of global public health procedures to contain pandemics, but in the absence of trust between citizens and government, can be seen as things that are being applied discriminatorily for people who are adherents to the current regime that is in power, for regions that are seen to be favored, for ethnic groups that might be seen to be favored. And of course, lockdowns and curfews, by definition, restrict people's rights, restrict people's access, and can limit services, which also can then heighten tensions in these governments. And right now on the continent, what we see is 17 countries who've declared states of emergency, 9 who've declared states of public health emergencies, and 3 who've declared national disasters. And again, without proper oversight, this creates more pressure on their systems related to security force abuses, delays in the 22 elections that are supposed to happen on the continent, a fear that the pandemic response can be the guise for extending oppression or repression of dissent, as well as extending term limits of governments that are already in power. The last point I wanted to touch on is the impact of this on the push and pull factors of African migration. And so one of the things that we know is that many Africans coming out of sub-Saharan Africa, trying to cross the Sahara or get into the Middle East or Europe, are now facing an additional stigma beyond just the kind of racist and xenophobic immigration barriers that are imposed upon them and the role that anti-Blackness and racism plays in that context. And so now you have the additional stigma of nations who are saying, look, these are dirty and backwards and criminal and diseased people who we have to keep out for reasons related to the pandemic, when in fact they were making the same argument about these people before the pandemic even came up. And so you see that happening in Greece, where they are actually taking Africans who have migrated to the country and putting them back in the water on rudderless plastic flotation devices that will not get them back to safety. You see drama and tragedy in COVID detention centers in Saudi Arabia, where Ethiopians are suffering greatly and primarily. Also, you see deportations coming out of Yemen, coming out of Israel, and coming out of Lebanon. And so these are some of the core issues that we see happening as it relates to human rights, governance, political fragility, and our current pandemic.
Well, I want to thank all of our panelists. You guys, each of you were brilliant in your presentations, and thank you so much for the insights that you offer. We have a few minutes left for questions, and I wanted to throw out a couple of questions, then whoever would like to answer, just raise your hand and please speak. I'm wondering about vaccines. Vaccine clinical trials. We know we're in discussions here in the United States about the clinical trials. There is some belief that there might be a vaccine by the end of the year. I'm sure you very well remember early in the pandemic when the French, I believe they were French, either elected officials or researchers who suggested that the virus should be tested in Africa. And so I'm wondering what you might know about clinical trials by African countries, African scientists, African researchers, or European or researchers from the United States that might be involved in clinical trials on the continent. I also wanted to know, and this is a question actually that came from Ambassador Linda Thomas Greenfield, wanting to address the issue of equitable access to vaccines and how Africans are looking to, when vaccines are developed, purchasing millions of doses, and what kind of efforts, maybe through the AU, maybe through the Africa CDC, that they're talking about how mass distribution would take place. So who would like to respond to that? Dr. Mugengwa?
Look, I think Africans, what I know is that Africans are pushing for global collaboration and a response to this question of vaccines. But at the same time, they also have some efforts on the African continent that are underway. There is the effort in South Africa that I know of, and the one that Dr. Gilpin just mentioned about where they're trying to develop a vaccine. So it's a two-pronged approach, trying to see what the continent itself can do, but also pushing for global collaboration on the development of vaccine that includes Africa, because Africa is concerned about being able to access these vaccines at an affordable price and to reach as many people as possible. So they're definitely pushing for a multilateral response on that issue.
Wonderful. Dr. Gilpin, would you like to add? You had addressed it somewhat in your presentation.
Yes, thank you very much. I think it's a very pertinent question because on the side of, as far as the production of a vaccine is concerned, African countries are very, very eager to be part of it. To make sure that some of the testing is done in Africa, because if that is not the case, the likelihood of the virus, of the vaccine being effective on the continent is pretty low. And so the CDC in Addis is definitely pushing for this to happen as well, and to ensure that we have a vaccine that works in the African context. But the second part, Congresswoman, is the logistics to ensure that the vaccine gets out in a way that is fair and equitable, and not just to those who are in the cities or those who are connected, the vulnerable groups, the women, the young people, the old people, those who live in the villages, those who are in opposition parties, those who have a different religion, those who are of, all of those categories. We have to ensure that we support logistics systems that ensure a fair and equitable. And this is not just the right thing to do, but from a healthcare perspective, it is a necessary thing to do. And as much support as African countries could get to address this logistical hurdle as well would be appreciated.
Thank you very much. Mr. Atkins, you can weigh in on that, but I also would like for you to address what you said about, I think you said it was Greece that were putting people back in the water. And I'm wondering if we know what the outcome, I can imagine what it is, but is it being documented? Because basically you're talking about them killing people. That, I mean, that's what it sounded like you said. If you want to weigh in on the vaccine, that's fine. Or if you want to expand
Yeah,
the thing.
absolutely, Congressman Bass. And I think for us, this is the time to really highlight this issue in Congress, legislatively and otherwise, in our diplomatic relations with the African Union, the European Union, and other nations. Because I think what is essentially happening now is, of course, these are core issues of urgency in the field of kind of humanitarian folks and folks who are working on refuge and kind of rescue at sea. But I don't think it's getting the kind of top line attention that it should. And one of the things that happens, of course, across the Mediterranean is that when people are out in the middle of the water, who is responsible for them? Is it the country that they were trying to go to? Is it the country that they left from? Usually the country they left from is not the country of their origin. And so we have this kind of no man's land where people are being left out to die. And I think one of the issues that we also would want to look at is what is the response of African governments to this, particularly because what is happening in these nations is part of the push factor of why people are this desperate to begin with. And so you can imagine what it would be like to leave a sub-Saharan African nation, to take yourself through the Sahara, and then if you survive, you now have to survive the crossing of the Mediterranean to get into Europe, where you would then still be often mistreated, living without refugee status or access to the necessary health care that you need in this time. So I think that it's going to take a collective, unified approach to this with political will and partnership between African regional bodies, European regional bodies, and the United States.
So right now, what is happening? Meaning, is the UN responding to this? Is the AU responding to this? And what are they doing?
Yeah, well, many people are right now expressing grave concern, which is a problem that we see, which just acknowledges the problem, but doesn't get into the devil in the details of how it would be coped with. And unfortunately, there was an article, two articles recently, one about what was happening to Ethiopian and Eritrean refugees or migrants in Saudi Arabia, who were in these horrid kind of detention camps for people who they wanted to deport. People are dying of COVID. People are committing suicide there because of their desperation. And it came out yesterday that actually the Ethiopian government was aware of this and had in some ways kind of tried to look askance, whether that's due to remittances, whether that's due to other kinds of diplomatic relations or benefits, remains to be seen. But I do think that there's pressure that has to be brought to bear at the regional level to make changes around this. And we've seen historically countries who have had these issues happen, forbidden their citizens to go as work migrants into Middle Eastern countries, and then relaxed those restrictions and allowed people to go again. And so the issue of Africans being mistreated in Europe and throughout the Middle East, there for labor reasons or other economic reasons, is a long-lasting problem. And it, again, is only compounded by this recent outbreak of the pandemic.
What about the European Union?
Yeah, I think that they need to be engaged. I think there's a struggle there, right? Because there's no kind of unified response that they have, right? So it's going nation by nation. And I think one of the problems that we have, and you mentioned this in your introduction of us, Congresswoman, is that we are seeing in many of these European nations the uptick in conservative nationalist governments. And those governments are becoming much more stringent in their barriers and in their kind of racist reasoning as to why so many of these people need to be barred. And so you have governance in the countries of origin, governance in the countries of destination, and then deserts, detention centers, and the death at sea in between.
Wow. Dr. Mugengwa and Dr. Gilpin, if you would like to address what the U.S. should be doing about all of this. What should our role be? Well, what are we doing and what should we be doing? Two different things.
Dr. Gilpin, you want to go first? I do have something.
Please.
AU.
Thank you very much. I think what the US could be doing, I'd like to highlight 4 things. First of all, I think the US should view Africa as an opportunity. Too often, Africa is viewed as a problem that needs to be solved. The value of Africa's trade is going to triple by 2030. Yes, there are 55 countries, but as a trading bloc, it is significant. Not just in terms of the exports from Africa, but also markets for manufacturers. It's the most, it's a continent where the adoption of mobile technology has grown fastest anywhere in the world. It's the continent where the middle class is expanding. It tripled in a decade. And so there's a lot of opportunity there. The second thing I think that the US could do is support regional initiatives. The African CDC, the African Union have been very strident in not just their thoughts about addressing the pandemic, but also in thinking through what a post-pandemic Africa would look like. I would defer to those regional institutions because they're closer to the ground and they've done the analysis. And in many cases, they have already initiated a lot of engagements and endeavors that are beginning to put the building blocks for a post-COVID Africa that is not as dependent and not as developed in terms of economic development as in the past. I think it's a unique opportunity to support regional initiatives. The third thing is that what we're seeing in Africa, and not just the drones used in Ghana and Rwanda, or the tech labs in Ethiopia, in Senegal, we are seeing that digitization and information technology and AI are being transformative. But what we're not seeing a lot of are the skills transfers that should underpin this sort of progress. And I think there's a lot that could be done in terms of partnering and partnerships that would enhance these issues. And then the fourth thing I think that the US can and should do is be very serious and consistent about governance. Because governance, not just governments, but governance at all levels. Basic things like social protection should be a human right. Access to health should be a human right. State-society relationships should be more predictable. And the remaining hotspots, the Sahel, the Horn of Africa, we should be a lot more forward-leaning in helping to bring those to resolution. I think if those four things would really help not just address COVID now, but start preparing for a post-COVID dispensation that makes Africa more of a reliable partner and a dependable ally than just a problem to be solved.
And I would just add to that, really a reinforcement of comments that both Travis and Raymond have made. I think that the first issue for me is just really a step back to look at the transformation that's occurring on the continent right now, and both positive and the negative implications of that transformation, and expanding our policy framework from a US perspective to engage with both the challenges and the opportunities. I think too often we are quite robust on the challenges, or we're more focused on the challenges, and we're not giving as much attention as we could be on the opportunities. And I think the challenge there is that the opportunities typically require an investment over the long term, that you are not going to see the results right away. Whereas on the challenges, you engage and you're focused on resolving a problem. But what we really need is a shift or a much better balance to address both those challenges and to make that long-term investment and engagement on some of the opportunities that Dr. Gilpin has talked about. So for me, that is one area. The second issue that I want to emphasize is this on the governance landscape in Africa. I have seen, and perhaps I am wrong, but based on my own analysis, our engagement on governance issues in Africa has not been or could be enhanced. Let me put it that way. We're very strong on certain dimensions of the governance question in Africa. We're very engaged on issues to do with elections. We're engaged with some of the backdoor diplomacy that we do in terms of the concerns that we have on the continent. But I think investing a little bit more in those mechanisms that speak to governance, the improvement of governance over the long term. For example, we could be thinking about engaging the AU on ensuring that the African peer review mechanism moves from a voluntary mechanism to one that is mandatory. I thought Mr. Atkins covered very well some of the governance challenges that we are seeing, but if leaders are not being held accountable on a regular basis and they have the option of opting out as to whether they're going to be assessed in terms of accountability to their citizens, that really puts us in a bad place. And maybe Mr. Atkins could speak to this, but my own read of how the European Union is engaging with migration in Africa is that it's really a preventative strategy. That how do we prevent Africans from crossing the Mediterranean? And so I think figuring out how the United States, the European Union, and the AU and other regional partners can work to address the issues that are causing the push, that are pushing people out, is going to be a key part of what we could do in resolving some of these issues.
Doctor?
Yeah, if I could speak to that just really quickly, Congresswoman Bass,
Sure.
Just a few quick points on that. I think I'd be remiss to not point out, the irony of the moment and the irony of the question, right? And so essentially when we ask that, what we're saying is, how can the nation with the highest number of COVID cases and COVID deaths on the planet help another region where we're not exactly sure what is going on with that? And I think too, when we look at the HIV/AIDS crisis and we see how support from internally and outside of the continent help to build those global health infrastructure systems, those then led to assistance in the Ebola crisis, where we gave additional support that strengthened the health infrastructure systems of the continent. And now we're in another moment where our outside support and assistance may open up another avenue for legislation or development interventions that can again strengthen that kind of support to the continent. The last thing I would just say is on the idea of electoral support. And so for nations who are going to cancel their elections because of COVID, what are we doing diplomatically? What are we doing programmatically to ensure that they're on course after it is safe to continue their progress towards representative democratic governance? Additionally, for those who decide to go through with their elections, what kind of support are we going to be able to give to them so that they can carry those out as safely as possible? And to remember that even though we're in this moment of crisis, again, as I would emphasize, all of the things that were damaging to people's lives before the crisis are still damaging to people's lives within the crisis.
Absolutely. Well, again, I want to thank you very much. And we're coming to the end now. And I would like to ask each of you if you have any final remarks. Dr. Mugengwa?
I think I want to close with where I left off. That even as we look at the current crisis, the current COVID crisis, I think taking that long perspective and especially ensuring that we continue to educate young Africans who are the future of that continent, who will be a majority on the continent in a few years' time, that is critically important. And so looking at the long term, starting now, to say how can we ensure that COVID-19 does not lead to a lost generation of Africans because we could not afford to educate them or we didn't prioritize this education and empowerment enough. That for me would be a key issue for all of us to focus on at the national level in Africa, at the continental level in Africa, and as international partners.
Thank you so much. And Dr. Gilpin, in your closing, if you wouldn't mind, you talked about the expansion of the middle class, and I just wonder what you might think now in terms of the contraction of the middle class because of COVID. You talked about people moving from poverty back into extreme poverty, but I'm wondering your thoughts on the middle class.
Thank you very much, Congresswoman. The COVID-19 has really hit Africa's productive capacity really hard. And what we are seeing is the number of cases are gradually rising over time. And so, yes, we're going to see more people who are in the middle class sliding down into the lower class, and more who are in the lower class going into lower classes, going into extreme poverty. UNDP and a number of other organizations have been talking about the institution of social protection mechanisms that will help these economies, help these businesses, help these professionals tide over. But in most cases, they're thinking in about a 6-month facility. And this is going to take multiple years to claw back. But we are also seeing a resilience in the African economy. People have started to look at different modalities to make a living. People have started to partner with the non-formal sector to ensure that they're able to they're able to make progress. So yes, the middle class is going to be hit, but we are beginning to see the resilience. In Africa, 41 countries have done detailed socioeconomic assessments of COVID-19, and they've looked at what sort of strategies are necessary to ensure that the economies do not slip. I think that having the requisite support to ensure that they're able to tide over is very important. But my final thought, if I may, is that what could we learn from Ebola? I think there's 2 things I'd like to table. The first is COVID is not an add-on. The COVID response is not an add-on to the development challenges. It's an integral part of it. It's not just a health crisis. It is revealing that the social side, the economic side, the governance side, the political side don't work as well together as they should. This is an opportunity for us to, as we've all said, shine a light on governance, shine a light on capacity, shine a light on the economic, and make it happen. Second thing is that we addressed Ebola and then we moved on to something else. And so we are seeing the Ebola-stricken countries still struggling to make it. COVID must be a longer-term engagement. We're in it for the long haul. And the focus has to be every individual citizen and how we ensure that they're well taken care of. So I think those 2 lessons are what I would end with. Thank you.
Wonderful. And Mr. Atkins?
I would just quickly echo Dr. Mugengwa and Dr. Gilpin and say, yes, the long-term impacts, the waves and implications of COVID-19 and paying acute attention to it long after it comes. out of the news cycle, because it's not called the novel coronavirus by accident. There are many things that are not understood by the world scientists about this disease, about its perhaps even decade-long impacts on individuals who contract it, even if they're able to go on and live healthy and productive lives thereafter.
Thank you so much, Dr. Mugengwa, Dr. Gilpin, Mr. Atkins. As we wind up this year's virtual Africa Brain Trust, I really want to express my gratitude to our distinguished keynote speakers and to these wonderful panelists. I also appreciate all of you joining us in this experience in remote meetings in our new way of life. I so hope that next year this time we are meeting in person. Several of our recent Brain Trust meetings have attracted nearly 800 people. This platform will actually allow for even more people to learn about what is happening in this vital part of the world. I hope you have found this discussion engaging and informative, and I look forward to continuing our work in the coming year. Please be safe, take care of yourself, and as I said, I do hope that next year this time we are back in person. Thank you so much.